Picture in your mind the image of a drug user. Images of grandma or grandpa probably didn't come to mind, did they? Well, maybe the image needs to change, because nowadays more and more people older than 50 are using drugs. So what can we do about it? Stay tuned for Drug Abuse and the Boomer Generation next. Hello, and thanks for joining us today for Drug Abuse and the Boomer Generation, sponsored by the Multijurisdictional Counterdrug Task Force Training Program, MCTFT. I'm Stan Rhodes. Today we're going to talk about how drug abuse is impacting two age groups that in the past have slipped under the radar. First, the baby boomers, those born between 1946 and 1964. And second, the older adults who were born before 1946. The numbers regarding the increase of drug use in these two age groups are alarming. The Substance Abuse and Mental Health Services Administration says the number of people aged 50 to 59 reporting the use of illicit drugs within the past year went from around 5% in 2002 to more than 9% in 2007. However, rates for other age groups during this same time period remained unchanged, or in some cases decreased. And SAMHSA predicts almost 4.5 million older people in the United States will have a drug problem by the year 2020. That's up from less than 2 million in 2001. So the problem isn't going away on its own. Well, let me introduce our experts joining me on the broadcast who will tell us more about the problem, how to properly treat it, and what happens next. First, Dr. Barbara Krantz is the Chief Executive Officer and Medical Director of Research at the Hanley Center, an addiction treatment facility in West Palm Beach, Florida. She's been practicing medicine in South Florida for more than 30 years. Her colleague, Mr. John Dybin, is the clinical director of the Hanley Center. He's also an ordained pastor. And Dr. Patrick Gallagher is currently in recovery. He is a graduate of the Hanley Center's Older Adult Treatment Program and currently works with the Center's Older Adult and Baby Boomer Treatment groups. Well, welcome everyone to the broadcast. I think it's going to be quite interesting. I'm interested in learning more about this, but I don't want to sound funny about this, but are we talking about somebody that's taking maybe an extra Tylenol, an extra Excedrin? What kind of drugs are we talking about? Dr. Krantz?
Stan, we're talking about not only prescription medication, probably used for chronic pain, which would be of the narcotic type, but we're talking about people in the baby boomer generation going back to illicit drug use that they probably did in the Timothy Leary age. You know, so we're seeing cocaine, marijuana, heroin in people that have lived a full life, a productive life, and they're actually going back to illicit drug use. And it's polypharmacy, so it's much more impactful physiologically as well as psychologically.
Patrick, are we talking about the same kind of drugs being misused for the older generation as well as baby boomers?
I think with the older generation, there's kind of this idea that those other drugs that Dr. Krantz was talking about are something that they just don't do, and it's the prescription medications and other socially acceptable type of drugs, but not the kind of thing that might be found on the street. That's not their thing. They don't relate to that.
John, is it both men and women?
Especially with the baby boomers, we find that it's true. They came from a generation where so much of the culture was all about equalizing the gender roles, and that was true in substance use as well. So especially with the baby boomers, we're seeing it across the board.
So why are we seeing drug abuse increasing in terms of baby boomers? Why is it just them? Why is it increasing?
I think part of it is that they're the only generation that grew up in a culture where there was a big question mark on illicit drug use. I mean, before that generation, it was very clearly something that's very negative. Currently, I mean, you know, my own children grow up in a just say no kind of generation where culturally
that the baby boomers are expressing to them.
That's exactly right, because part of what, you know, their experience was there was just culturally a question mark, and it was used, you know, Dr. Krantz referred to Timothy Leary, you know, it was used in research, it was used in higher education. There was a question mark that said, well, maybe this illicit drug use isn't such a bad thing. So that mindset is very unique to that generation.
So there's a justification for it.
Absolutely.
Patrick, why are older adults doing this?
As concerns the older adult, a lot of it, I think, has to do with the fact of aging. And as we age, more medications are needed, and then the more complex it gets. And also along with that comes the aches and pains. And once the aches and pains start, then there's the need for relief from that, and too often the relief is simply to write prescriptions that are habit forming.
But why are boomers getting involved in this? Why are they finding that it's okay to do this, Barbara?
Well, I think there's several reasons why they're finding it okay. First of all, they come more from a generation that if I have a certain issue, then there has to be something that's going to fix it. So
there has to be some sort of drug, or
there has to be some sort of drug or some sort of herb, or, you know, the baby boomer generation brought all of that to national attention, actually. But I also think that they are more in tune with, obviously, the internet. I mean, my experience as a physician between the older adult and the baby boomer, the older adult would come in and would have perhaps, you know, a backache. And they would ask me, okay, Dr. Krantz, what do you think? What do you think I need to do? The baby boomer generation would walk into my office and they would come in with a printout from the internet.
They're already prepared.
Right. They've done the differential diagnosis. They know exactly what's wrong with them, and this is the prescription that they want. So they're more informed, I think, through the technology that we have today. However, I think they also have less tolerance for any kind of discomfort.
Well, in that process, they're kind of bypassing the wisdom of the medical professional, aren't they?
Well, they certainly challenge the wisdom of the medical professional, and that's okay. I mean, we don't have issues with that. The problem is that there isn't better living through better chemistry. I mean, there are other avenues that need to be put into place to be most appropriate.
Mm-hmm. I guess I could ask myself this next question, and because I'm interested in knowing your opinion, but do baby boomers fear getting older?
Yes.
Absolutely.
Why is that? Tell me, help me.
There are a lot of reasons. One is that they come from a culture, again, that, you know, that time everything was about my rights and everything was about me. And as they get older, you know, they very strongly reject any type of ageism, any type of, they don't want you to sell them Depends. They're very much into, you know, that concept, better living through better chemistry. That's an idea that came from there that says we can conquer anything, and age is one of the things that we can conquer. So there's a lot of beating against age.
But is that true of all boomers? Because we're talking here about a 19-20 year spread. Is it true of all of them, or is it more seen in the older or younger boomers, so to speak?
I think you see it across, but definitely if you think of them as two groups, you know, leading edge, the older boomers, and the trailing edge, the younger boomers, I think definitely we see that more with those trailing edge, the younger boomers today.
I see. Okay. And Barbara, you were going to comment.
Even specifically, I think we're seeing it more with the 50 to 59-year-old boomers. 50 to 54, and then 55 to 59. They're pretty close in the medications that they use and the polypharmacy that they use. And then as you get older in that baby boomer generation, then the drugs become probably more alcohol as the predominant drug of choice.
Why do you suppose boomers have gotten involved in drugs? Otherwise, you're talking about the things that took place in the 70s, the hippie generation, etc. But did they see their parents, the older generation, get them going on this? What's your thoughts?
I think it was just more of a culture of drugs, and it became somewhat socially acceptable, even in elite circles, to do the type of drugs that the older adult would be aghast that someone would even speak of.
But you say in elite circles, so it was kind of a social thing to do, and not necessarily we do this, but we're not saying anything to anybody else.
Right, but it certainly wasn't exclusively in elite circles, but it was acceptable. It was more acceptable.
So what kinds of situations lead boomers to drug use, specific situations?
Please.
Go ahead, Barbara.
They're dealing with stressors in their life.
Stressors
like perhaps even the second phase of life, and this goes not just for the baby boomers but also the older adults. But in the baby boomer generation, again, that 1946 to 64, you're seeing people that with the disintegration of the family, there's more divorce, so there's a stressor. There are
economic stresses.
There's economic stressors. There's other, they're the sandwich generation, so to speak, because they may be taking care of their parents and at the same time they still have children at home. So that adds more stress to living. However, our hope is to teach them non-chemical coping skills as opposed to using the drugs for relief of stress.
Very good.
And I think what's interesting is that, at least it was interesting to me, is that the profile, in the state of Florida at least, for a prescription drug, actually overdose death, is a Caucasian male, educated, and has had a previous overdose experience in the past. So, and is over the age of 40. And we're talking about, this is a serious problem. We're talking about one death every 28 hours in Palm Beach County.
Of somebody that meets that profile.
That meets that profile. And we're talking about prescription drugs as well as the illicit drugs that are combined with it. This is a very serious problem that needs to be brought to attention.
Well, although no two people are the same, many baby boomers share some common characteristics. And we're going to hear from a boomer in California about what he has seen at a treatment center.
We have two main components. One is outpatient counseling, and that's group and individual. And the other is homeless services. We have an emergency shelter. And over the years, the two have gotten closer and closer together. We sort of specialize now in homeless people with drug and alcohol problems. There's really two kinds of baby boomer substance abusers. There's the ones who used from the time that they were kids, and there were the ones that started later in life. And there's a lot of differences in how that breaks down. The ones who started later in life, lots of times they will get into recovery fairly quickly because they have quite a few things in their life, families, jobs, careers, kids, and they start to lose them pretty quick once their substance abuse develops. And so they tend to show up here fairly early on in the problem. The ones who've been battling it on and off for 40 years or who haven't been battling it, have just been sort of flowing with it, and all of a sudden they're 47 and they have no work history and no money and no relationships and no place to live. That's quite a task. Grew up in the 60s in particular, when it was all innocent and it had kind of a political feel to it, and getting high meant you were in favor of a lot of good things and against bad things like the war in Vietnam and all that. And then the dark side of it that none of us saw. The people my age were the first generation that used a lot of illicit drugs in the kind of white mainstream society. Assuming they don't kill themselves, they are going to be seniors pretty soon, and they have not been taking care of themselves for years and years and years. And they're marching into seniority and into Medicare and into inadequate medical coverage with just a truckload of problems. I mean, most of us that didn't stop drinking and using, we're a mess. Malnutrition, medical problems, you didn't take care of operations, you didn't have minor brain damage that's coming on, the incipient organ failure. I mean, it's going to be a real treat when these baby boomers become seniors, you know. I've known people that were hooked up with partners who also used, and I mean, they used into their 40s and beyond. And it's very difficult. You've been doing something, you've been living a certain way. You have different survival strategies, and they involve criminality, or they involve being a hustler, or they involve sexuality, and that's kind of your main stock and trade for getting through the world. People have got to have a reason to get sober. I've been here long enough that I really do see that it's a long process. I mean, there's people that bounced in and out of here for 20 years and finally got clean and sober. If you've ever had it's really the privilege of being able to participate in the process where somebody just comes in just beat to heck. You know, they're just a mess, and they kind of pull themselves slowly together and kind of rise up out of the ashes, and in a year or two their kids are talking to them again, and they got a place to live, and it's just the most wonderful kind of feeling. I mean, to see somebody kind of be reborn like that.
Well, we had a lot of head shaking going on of agreement as we were watching this. I wrote down a couple of things quickly that he said. We're a mess. Survival strategies. Need a reason to get sober. Does that relate to you, Patrick, in your past?
Oh, yes, absolutely. In fact, in my particular case, I think chronic pain had an issue also, and we do see more and more of that also as the baby boomer generation gets older, and certainly we see it among the older adults. But there's somehow a feeling of a lack of guilt if you're doing what the doctor says to do, you know. However, often it's a bit more than what the doctor says to do, and then sometimes what two doctors say to do, and you mix that with the social drink, et cetera, and you're talking about a mess. You've ended up with a mess.
Well, that's what he was saying. Barbara, what happens to a baby boomer's brain when they start creating this mess? Can you give us a picture? I'm sure it's not pretty.
We understand today medically that the disease of addiction is a brain disease. Specifically, it's the mesolimbic system, which was old survival brain. This is important because the primary symptom of drug and alcohol dependency is compulsivity. It's that irrational, irresponsible returning to the drug despite DUI, despite losing your wife, despite losing your home. So the public at large may want to say, well, stop, just stop. And they do stop, but they can't stay stopped because it is a brain disease. We understand today about neurochemical transmitters and the sites in the reward pathway. It's a reinforcing behavior because of the abnormal biochemistry. So it helps the person seek that reward, and we've done a lot of studies on this, but that's really the bottom line. So they receive a euphoria from taking the drug, a feeling of well-being. It increases chemicals in the brain like serotonin and dopamine. Everything's okay with the world. I'm good. I can handle this.
But a temporary euphoria.
Exactly. It's temporary. And then they get a twofold deficiency and continue the drug. And that's why we see people walk into treatment with a fifth of vodka, an ounce of cocaine, however many narcotics they're using for their chronic pain. Because of this. It's an escalating, progressive disease. And they are a mess.
They are. They're chasing one thing after another.
Right.
How are they getting these drugs, John?
Well, a lot of them are getting them from physicians, getting them, especially as the disease progresses, they can doctor shop.
What do you mean by that, doctor shopping?
There are, once the chemical dependency really kicks in and the patient needs the drug, their brain is telling them you must
sort of
have
painkiller,
this
whatever
drug,
it might be.
whatever it is. And, you know, our younger generation will go, they'll get the things on the street, but the, you know, the baby boomers and those more sophisticated will go from physician to physician, and like Dr. Krantz said earlier, they know what to tell a doctor to get the meds that they want. They've researched it, they become experts on it. And so if you can go to several doctors and get several different scripts, then you can keep yourself in drugs.
So that process becomes a end to a means for them.
That's right.
Okay.
And they spend a lot of time on it.
What about drug advertising? We see a lot of it on television. What are your thoughts on that? Patrick, you want to weigh in on that?
Well, one of the things you'd think after they list all of the things that can happen to you,
which takes a third of the commercial just to tell you. Yeah.
Even though it's said very, very quickly, but along the way it says suicide, et cetera, et cetera. You'd think that people would pay attention to that. But once the desire for the drug has moved to a point that there's actually the brain change that Dr. Krantz was referring to, it wouldn't matter what the footer said. It wouldn't matter what the physician said. It wouldn't matter what the warnings say. They're just hooked, and they're going to use.
Is there such a thing as a casual user? Oh, I've got it under control. I can take this. I'm good. Do you see that a lot?
Yes. I mean, the disease is a progression. I mean, you go from use to abuse to dependency.
Use to abuse to dependency.
So, you know, statistically in the United States, 10 people use alcohol. Out of those 10, excuse me, let me back up. 10 people in the United States, if you took 10 people in the United States, out of those 10, 7, 8 would use alcohol. Out of those 7 or 8, 5 would abuse, and then the recent statistics show that of those 5, 2 actually become dependent, and that has to do with a biochemical genetic trait for this disease.
So it's different for every person.
That's right.
It is.
It can be different.
It can be different. So there are the casual user, and again, they receive a DUI or they're caught with drug paraphernalia. They're like, I need to stop, and they stop and they stay stopped. But once the brain is activated and they're in the abuse stage, and the American Medical Association says for the drug alcohol, it says more than 2 drinks a day equals abuse. We live in a very chemically abusing society.
Well, we see advertisements for that as well.
Correct.
Yeah.
So the disease going on to dependence, where statistically, as you said in the beginning of the broadcast, we have a real issue with this.
John, do boomers see this as a disease? Do they see it as a disease, or do they label it something else?
One of the interesting things about boomers is that they come from, 1946 is the year that Dr. Spock wrote his first, parenting book, and it's the self-help generation. So they come from a generation where there's an expert on every corner, and there's an explanation around every corner. So one of the things that, there's not as much a difficulty culturally with them accepting the concept of a disease, but where with the older generation it was very moralistic, and it was difficult to accept it as a disease. Baby boomers are very open. The problem is that there's so many other ideas that they really need very specific education on why it's a disease, what that means. So we spend a lot of time educating baby boomers on the neurochemistry of the brain and what's really happening. They don't have a problem accepting the disease concept, but there's so many other things out there that they've grown up in an expert around every corner generation.
Fascinating. Well, we're going to take a short break, and when we come back, we'll continue our conversation and talk specifically about how to treat the baby boomer drug user.
I waited for my best friend to end up on the street.
I waited for my brother to get arrested.
I waited for my wife.
I waited for my friend to total his car.
I waited for my sister to come. I waited for my wife to lose her job.
I waited until my brother went to prison.
I waited for my sister to say something.
I waited until my friend stole from me.
I waited until my best friend lost every friend she had.
I waited for my daughter to die.
What are you waiting for? Don't wait for someone with a drug or alcohol problem to hit bottom.
I'd rather have heart disease. That way you wouldn't look at me with shame. You and I could talk openly about my problem. There would be no stigma. You could ask your friends how their family members got help. If I had heart disease, you would understand that I need treatment, not hate.
Drug addiction is a disease. When you treat it that way, people can get better. Learn how you can help someone you care about.
And welcome back. Dr. Barbara Krantz, Mr. John Diamond, and Dr. Patrick Gallagher join me for our broadcast on drug abuse and the boomer generation. As we know, the number of adults age 50 and older entering treatment is increasing. So the question is, how do we best treat them? John, is treatment a one-size-fits-all approach?
It's absolutely not. I mean, it's a great question, and it used to, you know, if you went back 15, 20 years ago, you'd hear people say, hey, the disease is the same for everybody, and in recovery, the goal is the same for everybody, so everybody just needs to, that one-size-fits-all kind of was the idea. But what we found is that for different genders and different age cohorts, that the barriers from getting from point A to point B, the barriers to treatment are different. And so that's why specializing treatment, that's why we spend so much time talking about different cohorts, including the older adults and the baby boomers. We're looking at what are their barriers to treatment.
So is there a difference then with how you would treat a baby boomer and an older adult, Patrick?
Absolutely. I think one of the things with the baby boomer population, I would like their input on this, they're not very comfortable seeing folks that, we have some folks in the older adult unit, sometimes in wheelchairs, sometimes with situations that deteriorated mental capabilities.
Right.
And the baby boomer generation is not exactly comfortable with that.
Goes back to the age question.
Exactly. And likewise, the older adult is not comfortable at all with someone doing cocaine. Now, popping a few Oxycontins might be all right, but that street stuff, those are bad folks.
So mixing teenagers with this group would not be something to do.
Would be disastrous.
Disastrous. Do boomers, when you meet with them, do they get it? Do they understand that this is bad for them? That this has a residual effect to them? What do they say? What do they feel?
I think, do they get it initially? No.
But once they get it.
Once they get it, they are successful in treatment and in recovery once they get it. But the disease is not just medical, it's multidisciplinary in the sense that you have to treat the psychological, the spiritual, the psychiatric if there's a comorbid diagnosis. So wellness, all of that comes together in order to have a whole and a person that can continue in their recovery.
But what motivates them to come to see you at the Hanley Center?
And that's such an important question, and that's one of the things that why we treat different groups differently. We find with the older adults that they're coming into treatment out of absolute desperation. They don't. They're coming in because they have no other choice, especially those that are coming in for the first time. So they are physically compromised. They're about to completely lose their family, those types of things. The younger person often is coming in to avoid some negative consequence. They want to avoid a DUI, or they want to avoid getting cut off from the family.
A temporary avoidance.
A temporary avoidance. That's exactly right. We find with the baby boomers that they are actually coming into treatment looking for self-actualization. They're actually coming to treatment saying, I've conquered the world, and here I am. I can get anything I want. Isn't there something more? They come in for, there's an emptiness and there's a spiritual void, and they come in to find some actualization and some spiritual wholeness.
Do families get involved in this, or is this more on an individual basis? What do you find? A mix?
Families have to get involved with this. This is a multi-systemic, and they're affected by the disease. They're affected by what's been happening within the individual. So because Dr. Francis talks again and again about it being a multi-systemic disease, it's medical, it's physical, it's spiritual, it's also social, and it's also our families are highly affected, and they affect it as well. well.
But what happens if you have an individual come in, and it's not just the individual, it's their brothers, their sisters, their mom and dad, and maybe even their grandma and grandpa? Then what do you do?
Well, at Hanley Center, we have a very strong family component, and you'll find this in a lot of programs across the country, that they have components to treat the family members as well. And then as part of that, sometimes we'll find family members who also need primary treatment for chemical dependency, and we do everything we can to treat the whole family system.
To get the whole unit.
Yeah.
Patrick, I wonder if we might get a little personal. Tell me about your background. What brought you to the Hanley Center?
In 1987, I had my first back surgery. Had experienced a lot of back problems prior to that. But this was the first surgical procedure, which I had always stayed away from because, unlike a lot of people in my generation, I had always used alternative methods of controlling pain, and I had used acupuncture for 20-some years and other types of conservative therapies. The pain worsened. The medications got stronger and stronger and stronger.
Medications, what kind?
Well, for example, starting out with Tylenol 2 and moving to 3 and to 4, and then eventually all the way up to OxyContin. And a person who is genetically predisposed to alcoholism and drug addiction like myself, the physicians sometimes don't take that into account. We certainly can't put all the blame on the physicians because the addict and the alcoholic is not going to say what the physician
if it's not asked, you're not going to tell.
Exactly. In fact, you'll frequently see a documentation, patient admits to taking X number. Actually, my situation got to the point where it was affecting all of my family, affecting my wife tremendously, my children, and it was my children that had an intervention. So when you said the role of family, I had right away clicked off. Family is involved from the first aspect of treatment and all the way through. In Hanley's family program, the most important thing we have to do with family members is say, yes, here's the disease of alcoholism, chemical dependency, drug abuse. We explain that. But then we say, guess what? You've got a problem too, because you've been living with this problem for a long time and you've lost your focus. You're focusing on the drug and the person using the drug. You're not focusing on yourself anymore. And it's very difficult to get a codependent entrenched in that turned around to say, hey, there's something called self-care. That actually then they are able to be more supportive of their loved one who is in treatment and still suffering from the problem.
So you took what you learned, your personal experience, and now you turn it around and give it to other people. You make it available to others.
That's my goal.
That's your goal.
That's my goal.
Do you find people receptive to, I mean, obviously you've had a personal experience, but does that click with people who first come in the door and, well, you don't understand, my problem's different. But
particularly if there's an issue of chronic pain. Because
that's the hot button that
if they can understand, and they've frequently been told about my experiences as a patient in Hanley and how I came into Hanley, almost unable to walk and doubled over. And then they see that I am able to lead a productive life now, still managing my pain, but managing my pain without the use of any type of addictive medications.
Excellent. Dr. Krantz, how do you inform patients about what's going on inside their heads? How do you get that message across that A and B equals C, this is what's happening, and get that to them?
Well, we have a process in place. Initially, when the patient walks into our treatment facility, they are put in the detoxification unit because, first of all, they're not clear thinking. Pretty obtunded usually when they walk in. So after detox, they're put on the units. They're assigned a clinical case manager, a counselor, a spiritual care counselor, the whole gamut of psychoeducational material, lectures, group therapy. We do a very complete process as far as educational and also to help identify their barriers to recovery. So is it a control issue? Like I've been able to control everything else in my life, and I can't control this. So what's that about? Is it particular family stressors? You know, again, I'm taking care of children. I still have children in college. I'm taking care of adult parents, and I'm not taking care of myself. So we have all of the disciplines: psychology, psychiatry, spiritual wellness, medical, family, to help enable that person to get to where they need to be, where they don't have to rely on an addictive substance for happiness or for serenity in their life or for pain management or any of those. It's a long process.
There are alternative ways. Well, the group in San Francisco Bay Area is working to reduce drug use in baby boomers and older adults. They're trying to get resources and education out into the community.
Well, I've been working with older adults as the Executive Director of the United Seniors of Oakland and Alameda County since 1986. So in that capacity, I've seen a lot of older adults, looked at their quality of life, understand the fact that they experience challenges with alcohol, with prescription drugs, over-the-counter medications. And when we started this project, this was something that I was really pleased to support, and it was definitely something that they were very excited about.
In our prevention program, we focus on the greater environment, and we look at substance abuse as a complex interaction of factors that are happening. You can almost ask anybody and somebody will have a story about, you know, their grandmother and how she's been using medications, or a friend or a neighbor. It used to be where you could only purchase prescription drugs in a drugstore, but now grocery stores have them. It's very easy to get prescription drugs off the internet.
We look at a various amount of factors. We look at environmental factors and also individual level factors that really kind of perpetuate substance abuse amongst various populations of the community.
Well, the Senior Alcohol and Other Drug Project is an effort to try to come up with ways of promoting the issues that affect older adults relative to alcohol and over-the-counter prescription drugs, and trying to educate people about that, and trying to come up with something that I'm more interested in, the policy aspects, how we can address this area, because with older adult population growing and swelling, it's important that we try to get a handle on this.
A lot of older adults don't realize that just because they've had that one or two drinks every evening for most of their life and they were fine with it, that they can't still do that at 70, 75, 80 years old.
Well, in Alameda County alone, the unintentional injuries and hospitalizations for unintentional injuries grew by 43% for adults 60 and over from 1998 through 2006. So we see that as very alarming.
You start mixing alcohol and medications and your fall risk is going to go way up. So, and then you can get into this snowball thing where you drink some alcohol, you mix it with your medication, you get lightheaded, dizzy, you fall down, you hurt yourself, you go in, and now they have to give you painkillers because of the pain from your injury. So now you've mixed even more medications in there. Vicodin, hydrocodone, all those things are synthetic heroines. And they're painkillers. And that's what I was saying, when somebody gets to be 65 or 70 years old, it's probably unusual to be that age and not have aches and pains of some sort.
Sometimes they are over-medicating, and the problem is that the clients go to multiple doctors, and there's no coordination of that. So they're taking medications from different doctors, and they're not always compatible.
You feel like you're doing the right thing because, yeah, my doctor told me I have to take these Vicodin, I have to take these Darvocets, so I'm going to take them. And you kind of get into this cycle of, like we talked about before, unknowingly abusing these drugs and being addicted, definitely.
And they realize, wow, not only did this painkiller take away the pain from this acute injury, it also took away all those other aches and pains that I had. And now I can go back out and do things that I haven't been able to do for a while. So maybe I won't be real eager to tell my doctor that the pain from my current injury is all gone, and I'll keep taking these painkillers, and you know, if I could say my back hurts, and I'll get more painkillers because now I can function again.
One of the things we really do here at St. Mary's Center is we work with all kinds of doctors and psychologists and psychiatrists and medical clinics to try and support the senior in getting those multiple needs met.
Because they don't think of older adults as being addicts. It's just those phrases don't go together. Grandma, drug addict. Unfortunately, what happens most of the time, I think, is people will look at the older adult and think that there's issues with senility or dementia. And in reality, the issue may be more with the medications they're taking than it is with any dementia.
It's not that someone wakes up and says, I think I'll become an addict or an alcoholic. It happens. And for seniors, sometimes what happens is, you know, they drink socially for years and something happens and it makes that switch to abuse. And they might not be aware of it. And it's hard for the family. The family doesn't want to see that. They don't want to admit that.
That's why it's overlooked. That's why doctors don't notice it. That's why family members don't notice it. It's like these are prescription drugs that were prescribed for my grandmother, and she's taking them the way she's supposed to. She's not abusing them. Of course, in some cases, they may not know how many grandma is taking. She may be taking more than is prescribed for her. And I don't think that's probably all that unusual. The pain comes back, I take another pill.
In the next 25 years, the older adult population in Alameda County is supposed to increase somewhere between 120 and 180%. We need to start addressing this issue now, because when the baby boomers age, just shows in this county alone how just how many seniors there will be. We had a representative from Senator Ellen Corbett's office attend our work group meeting today. Having her listen to the work group and seeing that we're actually going to be calling on her for potential legislative action, I think she saw that we were serious, and so hopefully it will be raised on her radar screen.
This project is going to look at how we might develop strategies and policies to address this, as well as look at educating the broader community and bringing about more promotion around this area. I think if we're preventing this, it'll help to save costs to society, and as a county supervisor, we have the responsibility for health care. It would help to prevent excessive cost and provide resources.
Drug abuse and the baby boomers, it's not a localized problem, is it?
Not at all.
No. Now, is it hard for boomers, older adults, to admit, I'm an addict, I've got this problem?
Absolutely. That word, well, especially for the older adults, the word addict or alcoholic was a very moral negative, and so it's very difficult for the older adult. And for the boomer, they want to argue about terminology. There's an old mindset that says you must say those words, I am an addict, I am an alcoholic, in order to get better. And what we're finding is that those labels aren't nearly as important as we've thought they were before, and people actually can get better if they recognize the principles of their disease and what's going on with them. And so we don't need to fight. We've learned not, especially with the baby boomers, not to fight so much about specific terminology, but can they understand the principles of what's happening and what's going on.
So they don't need a neon sign that says I'm an addict, but
That's
they
right.
do need to remember that they are.
That's right.
Now, at the Hanley Center, you not only have treatment for boomers, etc., but you also have the older adult, and you recently added the boomers. Is that correct?
Yes, we have an 82-bed residential facility that has an older adult unit, a women's unit, a men's unit, and the boomer track. We also have a very large prevention department that goes into the schools and helps educate children, young adults prior to perhaps having a problem with addiction. And we have a family program also.
Is there a common point, Patrick, that people come in, I mean, they've reached this plateau, where high or low, whatever you want to say, got to have treatment, I've got to do something, this is it. Is there a common point?
I would say frequently when the person's life has become so totally unmanageable that they themselves realize something's got to change here, or in the case of many people that come for treatment, family members have realized that, and family members say, you are going into treatment. That can be a very difficult type situation also, very emotionally laden with all types of things. In my own case, when the intervention was taking place, it was actually a letter from my granddaughter that kind of did it for me. She said, Papa Pat, I love to sit next to you when we have dinner together. I love to be with you, but you're falling asleep all the time. And it really worries me, Papa Pat. I love you so much. I would have gone to treatment if they said Swahili. I'm ready to go, pack my bags.
Wow, that's very touching, very powerful. So what was it that Haley decided that we needed to branch and bring in the Boomer program?
We begin to see with our, each one has, as we've seen the needs of individuals, we split the men and the women, had a men's unit and a women's unit. And then many years ago, they began to see that the older adults were dealing with different problems from these younger adults. And so we gave them a specific track. And what we found is that on the older adult unit, we say 55 and older, we would often end up with two clear age cohorts there, almost, and the older adult would have a higher medical acuity. They would have a lot of different, the word that we stay away from is geriatric, but the reality is some of those geriatric issues. And then you'd have this younger group that's still very much active in work and parenting and such, and their barriers to treatment were different. And so what we did at that point is said that we need to have something to address specifically the needs of the baby boomers. So we've designed this tract. They're on the older adult men's and women's unit, but those that are in that age cohort are pulled out each day and get to spend time addressing their specific issues.
What has been the treatment success rate amongst the different programs going on?
We have a research study going on right now with a consortium, University of Miami Miller School of Medicine and Scripps, to look at outcomes. Because the validity of some of the outcomes are questionable, we will have our outcome research probably within the next 6 months. On an average, you're talking about perhaps 53%
across the
board. What we're trying to do is look at the specific interventions that will help treat the barriers to recovery so that we can be more successful. Again, we understand so much more about the disease of addiction today that we can put into place those things that will be profitable for the patient.
Is this becoming an epidemic within the boomer and the older adult? Immediate heads went nodding yes.
Yes, absolutely.
It's, as a physician, first of all, many physicians, I'm an old physician. I've been a physician for 32 years. I probably had about an hour in my medical school class as far as addiction. We're teaching at medical schools now, and they probably have 3 to 5 hours of education about the disease. We need to destigmatize the disease of addiction. It's just as much a disease as cardiovascular disease, hypertension, diabetes, and it needs treatment for the patient to survive.
So what can be done? You are a physician. What needs to be done? If you were to make changes right now, what would you suggest?
Well, prevention and education are one of the first steps, I believe.
But I'm talking about two medical professionals, those who are in pre-med or med school. What needs to increase for them? What do they need to?
They need more education about the disease. They're just starting to get it now. They need to understand that it's not that the person can just stop, that they need to understand the biochemistry of the brain, and that education is just starting to filter into the medical schools. We have an active program called Professionals in Residence at the Hanley Center that we actually educate physicians, psychologists, anybody in the field, or people that are interested in learning more about the disease of addiction so that they can that they can go out and help the clients that are coming to them for help.
Because I mentioned in the beginning of the broadcast that we're looking at, what, 4.5 million older people by the year 2020.
The statistics are, even if you look at the emergency room statistics, 40 to 50% of the patients that hit the emergency room are there for secondary symptoms of drug and alcohol abuse.
40 to 50%? Nationwide?
Nationwide, 40 to 50%. Now, are they being labeled an alcoholic or a drug addict? No, they may be in with a GI bleed, they may have a cardiac arrhythmia, but it's secondary to the drug and alcohol use. So our insurance companies need to get on board also.
So how do we get the word out? Patrick, what do you say on this? Weigh in on that. How do we get the word out?
Well, programs like this, for example.
Yes.
The more that the public hears about this, the more they hear that it is a disease. That it's amazing the number of people out there that still don't realize that this is a disease we're dealing with. It's a brain disease, and the more they understand about it, then the easier it is when they come to us to make progress with us with that. And the easier we can deal with their families also. Because sometimes families are also in denial.
Yeah. But a lot of what we hear and see on the media, John, is kind of aimed at younger groups about, no drugs, et cetera.
Right.
So how do we get that and transfer that information all across the board?
I think one of the things that we're seeing more and more is that we're finding that when we educate the people who people go to. So we're looking, who do people go to for answers? We find they go to their physicians, they go to their clergy.
They go to the web.
They go to the web. They go to
Wrong or right, they go to the web.
And that's a big one. So when we look at how we get the word out, is we look at our own website. We look at websites of different agencies. Our own website, we've designed it to be educational, good education. And we educate also those professionals and those people that families will seek out. We just did a clergy conference. We educate clergy, we educate physicians, we educate therapists, and help them understand, because what we find is if they can get a good understanding, then when families and individuals come to those professionals, rather than just getting a question mark or getting bad direction, they'll get good, solid education.
Do you feel that this country is saying this problem is too big? We just can't tackle another problem, and they're just ignoring it?
I don't think so.
No?
I mean, I really think that it's actually we're really doing a pretty good job of addressing it.
I think that with the parity bill that's on the table right now in Congress, that we are looking at being inclusive of the disease of addiction. And that's a major step, and it is very, very important, because again, people are dying every day from this disease, and it's a treatable disease. This doesn't have to happen. So things like you're doing right now, Stan, are very important in educating the public. I would like to see more commercials on television instead of some of the commercials that we see. If you have this problem, you need this drug. Perhaps, more educational commercials that would talk about the disease of addiction, and it is a disease. It's not the social stigma. It's not the guilt and shame that you should walk in with. Seek help for it.
It needs to start early, doesn't it?
It does. Well, that would be better, because then you wouldn't be treating a patient, a client that's coming in that is very, very ill. I mean, has multiple medical issues because of the physiological changes that happen with addiction.
Quickly, with the time that we've got left, what about those who are in the sandwich generation? Where do they fit in here? Do you have programs for them, treatment?
One of the things in any type of baby boomer program is going to be to deal with what we call Axis 4 issues. That means the psychosocial stressors in their lives, and that's a really big one. So the stressors that we talked about earlier, any baby boomer program really has to be one that will address how people can develop coping mechanisms for dealing with the stress and the difficulties of being that sandwich person without using mood-altering substances.
We're just about out of time, but I would like to take what we have left and get some final thoughts from you. This is a very interesting topic, and you've touched my heart in many ways. Patrick, I'm going to start with you. You told me the story about your granddaughter. That's really powerful. You hear other stories like that?
Oh, yes. It's amazing among the older adult population how often they will refer to my grandchildren. Perhaps I won't be able to see my grandchildren, most definitely. And I think one very important thing also to remember is this is not just the disease of the person that we're treating in residence at Hanley. This is a disease that affects every person in that family. Some are affected in one way and some in others, depending upon their age, their personality type. But the entire family is affected by this disease.
And that's true for you.
Absolutely.
And so now you are an example.
Trying to be an example, one day at a time.
One day at a time. Dr. Krantz, what would you like to add into this?
Well, I think we as physicians need to step up to the plate, ask the appropriate questions when the patient walks into the office.
Don't be afraid to ask the questions.
Don't be afraid to ask those questions. Ask family history. We understand better the genetics. Ask the stressors that spend time with the patient. I believe that's very important because primary care physicians are really our front line, and if we can identify the disease early, then the outcome is going to be better.
Frontline defense.
Right.
Okay.
And I'm not a football player.
But you might feel like it after some of the battles you go through, I would imagine.
Right. Yeah. I mean, we see miracles every day.
That's good to hear.
It is.
Miracles. John?
I think that for me is the primary thing. You know, one of the reasons why someone like Patrick is so impactful is because people often will come in feeling hopeless. The message is that there is hope. There's hope for those that are in the mires of this. There's hope for the family. There's hope for the individual. If there's anything that I could give anyone, it would be simply to know that there is hope.
Is that difficult to get across?
Often, but that's why people share their own stories. That's why Patrick and what he does is so powerful and impactful, because when someone comes in and they say, you don't understand, I've been dealing with chronic pain for 40 years, and Patrick can say, I do. I still deal with it today, and I deal with it drug-free. There's hope.
Very good. Now, the Hanley Center is where?
The Hanley Center is a nonprofit organization in West Palm Beach, Florida.
Mm-hmm. And you are the director of the...
I am the CEO of Hanley Center.
Very good. Well, thank you all. I really appreciate it. We are out of time, and we're going to leave you with some resources that you might find beneficial. If you can't write them down right now, you'll be able to find them at the MCTFT website, which is www.mctft.com. Once there, click on Broadcast /videos and then on Resources. On behalf of my guests, Dr. Barbara Krantz, John Dypen, and Dr. Patrick Gallagher, I'm Stan Rhodes. Thanks for watching Drug Abuse and the Boomer Generation.